Welcome to this channel made for me, and in this video we will learn about hematometra. Okay, so let's start with the hematometra. So hemato means blood and metra means uterus. So if there is any accumulation of blood within the uterus, then it is known as hematometra. Okay, and if we consider this as a uterus, okay, so then this part is, what is this? This is fundus. Okay, this is fundus, and this is the body, and this part is the cervix. Okay, and in cervix we have one internal os and external os. Okay, and in internal os there is two type of internal os. One is the histological internal os and another is the anatomical internal os, and the area in between this histological and anatomical internal os is known as isthmus. And in hematometra, the most common site where there is obstruction, okay, this part is the isthmus part. So we have to know that isthmus is the one of the common site for the obstruction of the lower part of the genital tract. So now the definition of hematometra becomes the accumulation of blood within the uterus due to blockage in the lower part of the genital tract. What does it mean? It means that if there is any obstruction in the lower part of the genital tract, the blood which needs to come out, or the secretion which is present in the uterus that needs to come out of the uterus, they get collected because they cannot get out of this lower genital tract as there is obstruction. So this accumulation or blood or any secretions get accumulated, and if the accumulation content is blood, then this is known as hematometra. Now this hematometra, it can be caused due to primary cause or secondary cause. Okay, so what are the factors, what are the things in the primary cause? So the first one is the congenital anomalies. Listen, during embryogenesis, okay, during embryogenesis, this lower part of the genital tract is forming from the Müllerian duct. Okay, this is forming from the Müllerian duct, and during the development of Müllerian duct, if there becomes any abnormality, okay, that leads to the formation of either imperforate hymen or transverse vaginal septum, then it can lead to the congenital anomalies. And if we know that if there is any obstruction, okay, if there is any obstruction like imperforate hymen, suppose here is the hymen, okay, here is the hymen, and this hymen is imperforate, like it is not broken off. Now what happens when, like, this is the imperforate hymen, okay, and if this hymen is not broken, okay, if there is no any perforation, then during the menstrual cycle the menstrual blood needs to come out from the uterus. Okay, but what is happening here? There is no any perforation in the hymen. Okay, the hymen is imperforate, so the blood which needs to get out of the uterus, they get collected in the, okay, they get collected in the uterus, and it can lead to the hematometra. Similarly, if there is any transverse vaginal septum, okay, if there is any transverse vaginal septum, then it can also lead to the obstruction to the outflow of blood from the uterus. So the primary cause is clear. Now secondary cause. So in secondary cause, it can occur due to post-procedural stenosis. What happens in that? Like if any procedure is done, in this lower genital tract, like dilatation and curettage is done, okay, like dilatation and curettage is done, or if there is a procedure done called is known as cone biopsy, okay, there is any cervical carcinoma, so for that the cone biopsy is taken, or any cryocoagulation or any electrocautery, if these are the things which is done, these are the procedure, and after this procedure there becomes the overgrowth of tissues around the either cervix or in the vagina, that leads to the stenosis. Okay, so the post procedural stenosis is one of the secondary cause. The second one is malignancy. If there is any malignancy, okay, if there is like malignancy like carcinoma cervix, then also it can lead to the obstruction. Okay, So malignancy is one of the cause, and the radiation can also cause overgrowth of tissue. And in old days, the senile atrophy is also the cause of hematometra. And the most important, which is very rare, less than 0.5% incidence, but the important one is known as the post caesarean section hematometra. So at first we will learn the risk factors. So what are the risk factors that can predispose a woman for having the hematometra? So the first one is the previous caesarean section. Like the caesarean section was performed on a female at first time, and due to the poor healing, okay, due to the poor healing, like female may be having uh, diabetes or anemia, malnutrition, she may be smoking, okay, due to these factors there can be very poor wound healing, which leads to the formation of any scar or any tissue that can lead to the obstruction. Okay, so the risk factor, the one risk factor is the previous cesarean section, and another risk factor is this diabetes, anemia, malnutrition, and smoking. And another is the infection, like if there is any infection in the endometrium leading to endometritis, finally leading to edema and adhesions. So this can also cause the hematometra. And the third one is young primiparous women. Like in the primiparous means the first, the woman who is having her gestation more than 28 weeks. Okay, who is the female who is carrying uh, the baby in a womb more than 28 weeks, then these females are known as primiparous. Okay, and these young primiparous women, they have usually a tighter lower uterine segment. Okay, this uterine segment is usually a tighter. Okay, this lower uh, uterine segment is slightly tighter, due to which there can also be obstruction. Okay, and another is the coexisting fibroids or uterine malformation, like if there is any fibroid in this part. Okay, okay, it can be mucosal. Okay, it can be submucosal, then it can also lead to the obstruction, finally leading to the hematometra. Now we'll talk about the hematometra which is due to post caesarean section. Okay, so it can be either acute or chronic. Okay, acute one means in a very short period of time, and chronic means over a long period of time. So in acute, why does it happen? It happens due to impaired drainage of lochia from the uterine cavity. Like after delivery, the lochia has to come out of the uterine segment, okay, uterine body, but due to any obstruction, but due to any cause, there is the impaired drainage of lochia that leads to the collection of blood in the uterus and causing the acute hematometra. And in chronic case, there is impaired drainage of menstrual blood from the uterine cavity. Like after post caesarean section, the blood, the menstrual blood, the female will start having regular menstrual cycle. Then after some time, there occurs some obstruction in the uterine cavity that leads to the impaired drainage of menstrual blood. Okay, that can also cause the hematometra. Now we have to know pathophysiology. So how this obstruction is occurring after the post caesarean section? So the first one is the cervical canal obstruction. Okay, the first one is cervical canal obstruction. So the cervical canal, we know that this part is the cervix. Okay, so the cervical canal obstruction, the one cause is iatrogenic cervical stenosis. Like while doing the C-section repair, we take a bite of endometrial tissue, okay, endocervical tissue, and during this, if the sutures are placed too close across the endocervical canal during C-section repair, then it can also cause cervical stenosis. So it is due to the obstetrician. Okay, it is due to the physician, obstetrician. So it is the iatrogenic cause. So it is one of the iatrogenic cervical stenosis. And another, after suturing, okay, after suturing, like edema or hematoma formation can occur at cervico-ischemic junction, which can also compress the canal. So if the canal is compressed, then also the blood cannot come out of the uterine cavity. And sometimes there is blood clot after after C-section repair, there occurs a blood clot, okay, at the cervical os, and it acts like a mechanical barrier, due to which there is again obstruction, and again the blood cannot come out, leading to the cervical canal obstruction, finally the postpartum hematometra. And the second cause is excessive inversion of uterine edges at incision. So during suture, surgeon takes, I already told that surgeon takes bite of myometrium, okay, and if these sutures are placed too deep or too tightly, then uterine wall are turned inward into the cavity. Like this is the uterus, and if we take the bite, if we take a bite during suture, okay, this myometrium, and if we take very deep bite, okay, very deep bite or very too tightly, then what happens, this endometrium get like inverted, okay, these edges get inverted, and due to this there is abnormal fold, and finally leading to the pocket formation, and again there start collection, due to which hematometra can occur. Now, the third cause is the intrauterine adhesion formation. Like due to uh, uh, like during delivery, if there is a case of like retained placenta remained retained for more than 30 minutes. Okay, so during that time, the either manual removal of the placenta is done, okay, or vigorous curettage is done, and during the vigorous curettage there can lead to the formation of intrauterine adhesions, okay, so that can also lead to the hematometra, and also there can be retained tissue at a lower uterine segment that may block the outflow tract. So this one is also the cause for hematometra. And I have already told that there is uterine scar hematoma at the incision site. Okay. So any collection of blood can occur. Okay. Like in the uterine scar. Okay. This can also compress the endocervical canal, leading to the formation of hematometra. Now we have to know the clinical features. So the clinical features, the first and most common is the lower abdominal pain, okay, and the second one is retention of urine, and third one is the reduced or absent lochia. So these three complaints are the major complaint by which the patient present to the either emergency, okay, or either to the OPD, that she is having lower abdominal pain and she is having retention of urine. Either it can be acute or chronic, or there can be reduced or absent lochia. And during the collection, and like during the collection, if there is collection of blood, like here is the collection of blood, then it can compress the urinary bladder system also. So, and there is the like this is the urinary bladder, okay, this is the neck of the urinary bladder. So this blood can compress the urinary bladder neck, okay, urinary bladder neck, due to which there can be retention of urine, and sometimes it can also cause urinary urgency, urinary frequency, and if it compresses the bowel, then it can lead to the constipation, okay. So due to the mass effect, constipation, urinary urgency or frequency can occur, and if there is infection, then there can be fever and there can be foul discharge. And in long term, if there is hematometra, it can cause chronic pelvic pain, secondary amenorrhea, post-menopausal bleeding, and infertility. Now what we have to do? We have to do examination. So at first we will do the general appearance. Okay, we will look the general appearance. We will look for anemia. Okay, we will look for anemia, and then we will examine the abdomen, okay, to know the involution of uterus. So what is the size of the uterus, we have to know that, and also we have to do the pelvic examination. Now for investigation, simply we can ask the patient to do an ultrasonography, okay, abdomen or pelvis. Then if there is echogenic or clotted material within the uterus, okay, then it is showing that there is collection of blood, and we have to separate this collection of blood. Either this is the blood or this is any secretion, other secretion like pus. If there is any pus formation, then the hematometra converts to what? There is pyometra, not blood, there is pus, so it is pyometra. And the second investigation we have to do, we can do like MRI. These are usually not needed, but we can do. And the third one is the hysteroscopy or saline infusion sonography. These are the investigation which were done previously, okay. Nowadays these are not preferred. Only the ultrasonography it is done, and After doing ultrasonography, the patient actually is presented to the emergency. So what we have to do immediately, if the patient is having the symptom like urinary retention, then what we have to do at first, we have to relieve the urinary retention. So what we do Foley's catheterization. Okay. Then after retention of urine, what we have to do? We have to drain the blood. We have to drain the blood. So either we can do in the minor OT or in the OT, we have to drain the blood. And after that, we can give antibiotics. Okay. And why we give? Because there can be chance of infection. Okay, so to treat or avoid infection, antibiotic is given. And the final the treatment in hematometra is the removal of the blood and the treatment of the cause. Okay, if there is any cause, the cause which I have already told you, if there is any cause, then that cause needs to be repaired or treated in order to prevent the further collection of blood in the uterus. So with this I have completed the hematometra. Hope you enjoyed this video. Thank you so much. Please like, subscribe, and share my video to your friends if you enjoyed this video and if it helps you for a study purpose. Thank you so much.